Female lawyers in Kogi State have been charged to uphold the ethics of practice and help to disseminate information about the state's primary health care and its benefits to the people across the 3 senatorial districts. The call was made by Onoja during the monthly meeting of the International Federation of Women Lawyers at the Nigerian Bar Association House in Lokoja, Kogi State. The guest lecturer Onoja emphasized more on the need for lawyers to enlighten and educate the people that primary health care is a fundamental human right that they must enjoy. Our reporter has more. Kogi State chapter of the International Federation of Women Lawyers held its monthly general meeting and lecture in Lokoja with the theme Primary Health Care, a Fundamental Human Right. The guest lecturer Onoja said the lecture is aimed at informing female lawyers on the need for adequate advocacy, mobilization and sensitization of the people in rural areas to make effective use of the primary health care system provided for them by the state governor, Yaya Bello. Alex said the partnership with Fida will help to reach out to the people who are not well informed.
After the 1978 declaration, the Alma Ata Declaration in Kazakhstan, Russia, is affirmed by the world body, 134 countries, under the auspices of the World Health Organization, that primary health care is actually a fundamental human right that should be the right of every citizen of every country. Best advocates in the world are lawyers. Lawyers do advocacy, that's their primary responsibility. And women especially. So Fida will advocate on the good work of His Excellency Governor Advocacy, which they have promised, by making sure that our people are aware of their rights, of all the provisions for primary health care. You see, primary health care is the first point of call for health. Now, people are, like they said, they observed that some people in the rural area are not even aware. So Fida has decided to go to the nook and cranny of Kogi State, all the grassroots, every local government, to carry out the advocacy for people to know that, yes, your right is here, and His Excellency Governor Zubulu has provided for your right. The Commissioner of Health, Dr. Zachary, and the Primary Health Care Development Agency, Dr. Abakar, and also the Executive Secretary of the Kogi State Health Insurance Scheme, has also provided for your right. Now assess it. That's exactly what Fida's role is, in ensuring that people get mobilized. I call it mobilization. So it's advocacy and mobilization.
Onoja also lauded the continuous efforts of Governor Bello in the health sector.
And we've been able to understand the role of His Excellency Governor Bello, especially in promoting primary health care in Kogi State. Not only primary health care, the Bello care, the Kogi State Health Insurance Scheme were all extracted and discussed as the fundamental right of our people. Let me borrow the word of His Excellency Governor Bello at the launch of the Bello Care program. He said all these programs that have been legislated upon and signed by him will continue even when he leaves office, that he will make sure that his predecessor will continue this good work. And you see, gone are the days in the past where people easily change laws. These laws have been passed as bill by the State House of Assembly. It's not like before the advent of His Excellency Governors. You know, governors just came on inception within 1 year, signing 50 bills. Then we were having laws. We never had laws. Take, for instance, Kogi State Mineral Resource Bill. It wasn't in existence. That was why we could trade off our so-called great resource, Obajana. And today, when the law came up in the instance of His Excellency, we can now interrogate the law and we know that something is wrong, that there was no consideration. And that's why all these things are coming up. Before now, because we were doing family meeting affair, signed letterheaded, and that was what brought us here. But today, these are things we are trying to correct. So all these bills, the Kogi State Primary Health Care Development Agency, the Kogi State Health Insurance Agency, the Bello Care, are all signed into law. And they will ensure continuity in the language of His Excellency Governor Advocacy, with his good intentions, I can assure you.
The chairperson of the International Federation of Women Lawyers, Kogi State Chapter, Barrister Ajuma Lilian Okolo, and other members of the association expressed gratitude to the state government for the intervention in the health sector and promised to embark on proper sensitization to educate the people about their rights to good health care services and enlighten them on the need to make good use of the primary health care facilities in the state.
What we do as Fida is to protect, promote, and preserve the rights of women and children. And in that, we actually say we are fed well or considerable because we actually attend to women in distress. Our strategies mainly are campaigns. Usually we go out to schools to do sensitization. So we are seeing that as a medium where we can actually talk to the children to send out those messages to their parents and people at home. And also we are trying to see how we can make use of the media to also enhance our sensitization.
Okay, first of all, I want to thank the governor for the launch of the Bello Cares Health Insurance Scheme, which is a very good innovation as it will help the citizens of Kogi State to access affordable health care. And we want to thank the coordinator for today's training who taught us about the primary health care, how it is our first point of call. Every single time we have an ailment or we have a complaint, we don't have to go to the big hospitals first. We can always go to the primary health care first. And then Fida Kogi, in her own way, in her own little way, will do everything we can to take the awareness of the primary health care to the grassroots as much as we can.
Coming to this lecture, I have learned a lot. I've also learned that there's something in place like that I could also benefit, and women like me in the grassroots can also benefit. So we have been given the charge to take this thing to the grassroots. So as a FIDAN, I will do all my best alongside my colleagues to take the advocacy to the grassroots, to meet the women.
Recently, Kogi State Governor launched the State Health Insurance Agency that provides free quality medical health care to indigent citizens of the state, and over 3,000 women and children are already being registered and captured into the system that will take care of their health challenges for a whole year free of charge.